Hi, and thank you for joining. We are in this together. I'm Angela. I'm with the Red Cross based in the Caribbean, and I'm at home, like many of you are. I'm fortunate in that I get to work from home, but I'm home, and I'm home because of COVID-19. And that's why we created this program. It's a look at the fact that we are in this together and what that means, how we can look after ourselves, our family, our friends, our community, people we don't even know can be protected by the actions we take. We also know that there are rumors and different kinds of information and a lot of questions out there regarding coronavirus and COVID-19. And so we really wanted the opportunity to give some of the straight facts, give good information, have something that can be shared, and a place where you can put your questions. As we talk today, feel free to put your questions below. We'll have people who will check and answer them. And if we're getting a lot of the same kind of questions, that helps us inform what we'll talk about in shows into the future. This is just the first one. Week after week, we hope to continue to provide you good information about coronavirus and COVID-19, what it means to you and your family, how you can stay safe. And we'll be talking to national societies across the Caribbean. What are they doing? How are they supporting their communities? What kind of activities are going on? All of this to say, as I started, I'm home because of COVID-19. Now, some people might even be asking, what is COVID-19 or what is coronavirus? So I am not a medical expert. I work in community engagement. I work in communications. It's my job to help try and make information manageable. I get my information from Red Cross. I also get it from the World Health Organization. So when I talk about what is coronavirus, it's information that I've received from those sources. So coronavirus is a type of virus. Some of the things that make us sick are bacteria, some are viruses, some are funguses, but this is a virus. Other viruses can be like the cold or flu, but this is a different kind of virus, and people who are getting it get quite ill or can get quite ill depending on circumstances of things they are already affected with. And it's new. That's why we're calling it a novel coronavirus. Now, what does that mean for COVID-19? Well, COVID-19 is the disease one gets when they catch that particular virus. COVID-19 because it was first seen in 2019. So hopefully that gives you a little bit of understanding about what it is. Now, I guess the next question becomes, how is it transmitted? And then, of course, what can I do to stay safe? So COVID-19 is moved through droplets that come from your mouth or nose if you sneeze or cough. If you're one of those people who tend to spit a little bit when you talk, that could be another way it's transmitted. So it is little droplets that contain the virus that helps the virus to spread or helps COVID-19 to reach more people and become that worldwide pandemic we've seen. So knowing that it is a matter of droplets, how do we protect ourselves? Well, first and foremost, we want to sort of have that distance, right? So we're saying stay home, stay away from other people. But if you have to go out, say you're going to the grocery store or you need to go to the pharmacy to pick up some medication, so one of those reasons when you really need to leave. Well, we're looking at staying distance. Social distancing, you've heard, physical distancing. We're looking at about 6 feet or about 2 meters, so just longer than my arm span. That's what we're talking about. That's how far you want to be staying away from other people, because if they sneeze or cough, then those little bits can move that far. What can you do? Well, you can protect others by, if you cough or sneeze, using good hygiene or like we say, cough and sneeze etiquette. So if you're going to have the sneeze, hatchoo into the elbow pit, or coughing into the elbow pit. Or if you use a tissue, hatchoo into a tissue, you want to make sure you throw out that tissue immediately and that you give your hands a good wash afterwards. Hand washing, which brings me to the next thing, hand washing is a really, really important way of keeping yourself healthy and safe during COVID-19. Good hand washing is really important. So what does good hand washing mean? Well, I know for one that historically I have not been a good hand washer because I'm the kind of person who does a little bit of soap and water, gives it a good rub, we're done. Now I find myself following the instructions that I'm going to show you here. So you can see there's a number of steps, and you want to be taking at least 20 seconds. And you start to realize how long 20 seconds is when you're washing your hands. So if you hum like the happy birthday song, happy birthday to you, that one, if you hum that, or if you're wanting to count, that's fine too. If you've got kids, the song is really good. 20 seconds of song is good to help them sing so they know how long they go. And you want to make sure you're washing your whole hand. So as I was saying, it's not just a quick, okay, I'm done, right? Like it's the fronts, it's the backs, it's the thumbs. I mean, it's the fingernails. You want to get in there. So you saw in the graphic all sorts of steps, and those are really important steps to be following. You really want to wash your hands multiple times during the day. And definitely, if you're coming in from outside, you want to make sure you're giving your hands a really good wash. It's a really good way to protect yourself from the spread of COVID-19. Another really good thing is trying not to touch your face. So as you watch this video, I'm sure you will see me do it at least once or twice. I'm very bad for it, but I am trying really hard not to touch my face. The idea is if you've got some of those droplets, if you've picked them up from somewhere and you haven't realized it, maybe you haven't washed your hands right away, you haven't had soap and water available, or you haven't had some of that good alcohol-based hand sanitizer, because that's a good one too for 20 seconds. If that's not available and you haven't washed your hands yet and you have an itchy eye and you scratch your eye, that's the way that it can move from where it was on a surface into you. And how long it will last on a surface depends what the surface is. It could be several hours or even up to a couple of days. So it's also really important that you wash surfaces in your house. If you're staying at home, but you are staying at home with family members, or maybe you have a roommate like I do, you want to make sure that some of those shared surfaces are being cleaned. Door handles, you can see that one behind me. Door handles, light switches, maybe if you have a shared countertop or area where you work. It's another good thing that you might want to clean. So keeping those things in mind and those steps in mind will help to keep you safe. I know we sometimes get questions around what are the symptoms? Like, what does it look like if I have coronavirus? Like, what will I experience? Well, they can be varied. A lot of people, and I want to make sure I get this right. So let me just check something here. So we're looking at people who have a cough. There might be a runny nose, sore throat. Some people have aches and pains or diarrhea. And then what we say is if you start to experience severe symptoms, so you have a very high fever, a cough, and you can't catch your breath, you're having trouble breathing, like you really just can't get breath in, that's when you want to start looking at contacting medical help. Make sure you know, even before anyone gets sick, how to contact medical help in your country. It's different. Sometimes they have a number to call because they don't want everyone who's experiencing symptoms or think they're experiencing symptoms to just go to the hospital, because then you run the risk that if you're not sick, you could maybe pick it up there. So you really want to make sure that you are following the guidelines sent out in the area or region that you're from. I don't know if these are your questions. If you have other questions, please get them in the comments below. We'll do our best to answer them. As I said, if we're not answering them today, we can look at answering them tomorrow or the next day or the next time we do this video. And if lots of people are asking the same question, we really do want to make sure that we are sharing that information. As I mentioned before, good information is really, really important throughout this time. You know, sometimes you get a WhatsApp message with a meme and sometimes it's funny, but sometimes it's also, has information in it. And then you're thinking, well, I'm going to share this with all my friends because it's good information. What we're asking is if it doesn't have the source of information on it, if it doesn't say it's from the WHO, the World Health Organization, if it's not from the CDC, Center for Disease Control, or from the Red Cross, or another organization that works with health, the Ministry of Health in your area is another good example for good information. If it doesn't have those sources, we ask that you double check before you share it. There's so much information and people really want to take care of their friends and family and community, which is amazing. But we want to make sure that the information we're spreading is good information. We want to make sure that what we're telling our friends and families to do will help keep them safe. Sometimes we see things about wearing masks or gloves. So those are very interesting topics and conversations to be having right now. People say, oh, I want to wear gloves all the time. But if you put on a pair of gloves and you treat it like it's your hands, so you go and you pick up something or you buy something and you've got money in your hands and then you've got that itchy eye again that I was talking about before, and you scratch your eye, Well, it doesn't matter if you're wearing gloves. You've protected your hands, but you still haven't protected yourself from the spread of COVID. So one of the things that we are really recommending is sort of a, do I need to wear gloves? Q&A to yourself. Well, the first one is, are you working in a healthcare setting? Because if you're working for a healthcare setting, we strongly recommend you follow the guidelines that are set out by the setting that you're working in. The next question is, if you're not doing that, are you caring for someone who's sick? If you're caring for someone who's sick, we recommend that you wear gloves when you're working with that person. And then when you're finished, you take off your gloves without touching your hands to the outside of the glove. You want to turn them inside out as you pull it off. And then make sure you wash your hands really, really well once you get those gloves off. That really good hand washing we were talking about. If you're not taking care of someone who's sick, be really cognizant about when you think it's a good time to wear gloves. You're better off if you're thinking about what your hands have touched and then washing your hands really thoroughly when you get in. So again, that's soap and water for 20 seconds, or that good alcohol-based hand sanitizer for at least 20 seconds, making sure that you are doing your best to get everything off your hands when you come in. Some people are wearing masks. Governments in some countries, here in Trinidad and Tobago, they've said, please wear masks if you're going out. But they're recommending cloth masks because they want to save the N95 masks for the healthcare professionals, those people who need it because they're caring for someone who's sick. So if we think what you should do is follow what the guidelines that your government is setting out for whether or not you should wear masks. Keep in mind, though, if you are going to wear a mask, that now has been touching the outside world. So don't adjust the mask with your hands and then touch your face somewhere else, right? Because then once again, we're in the same situation where you have maybe something on that mask on the outside, so your nose and mouth is safe, but then you get the itchy eye, right? So if that mask goes on, you leave it on, you don't touch it. When you come back, you take it off. If it's a cloth mask, you immediately put it into the plastic bin or the laundry basket for the next time you're going to wash. You don't want to have that just kind of kicking around. You don't want to have that so you can use it again. You know, wear it once, wash it once. If you're going to be going out a whole bunch through the course of the day, you want to make sure if you wear it and you have to take a break, you want to wash it, get a different one for the afternoon, right? So these are just some of the tips that are out there around staying safe and healthy during COVID. Of course, the best way to stop the spread of something is to not go out, right? To spread, COVID needs to move from person to person to person through the droplets. If you aren't outside, you can't pick it up. It can't live in you, right? So unless you have to be going out, stay home. It's the best way to protect yourself. And it's the best way to protect the people who have to go out, the people who are the healthcare workers, the people who are part of the essential services that are making sure all of us can continue to move forward and be safe and healthy through this time. There are a number of myths out there. We've heard some of them, we've seen some of them. Some of them I want to just sort of do some myth busting for you right now. I want to peek at them to make sure I'm getting them right. We want to make sure that we are myth busting and as I said before, making sure we're really getting information from the best places and getting good information that we can share well. So things like, people have been asking if coronavirus can move through mosquito bites. At this point, we have not seen any evidence of that. So there is no mosquito bite that transmit corona. Also, there's this idea that if you're older, that's the only person who will be affected. You're the only people who will get sick. So that's not entirely true. Anybody, people of all ages, can be infected by coronavirus. The thing is, people who are older or those who have pre-existing medical conditions like asthma or diabetes and heart disease, those people are more vulnerable to becoming extremely ill. So it's not so much that you're young, so you won't get it. It's more that if you get it, you might not be as sick. But even then, we see people who are younger who can be quite ill. So the best bet is to just be safe and protect yourself, but also protect your family and your loved ones. There's the idea that a hand dryer, you know, those dryers in the public bathroom, that could kill coronavirus. Those are not enough. We want to make sure we're washing with soap and water. That will help do it. Also, there's the idea that garlic will help prevent the spread of coronavirus. While garlic can be healthy, there's no evidence that says that, well, if you eat a lot of garlic or you wear garlic, that is going to help you avoid getting COVID-19. So these are just some of the questions we've heard. If you hear things that you want clarification on or have any other ideas about like, oh, I think I heard this, is it right or wrong? Please let us know. We really want to make sure we're reaching people with information that is useful to them. We are in this together. I mean, the steps that we take as a community, the steps that we take as a whole will help each other stay safe and healthy as we move through this pandemic. And I just can't say it enough is like, make sure you're getting information from a good place. Ask questions when you need to get more information. Stay tuned. We're going to come back next week and talk about some of the ways of dealing with stress and getting some psychosocial support during this time, because it can be really stressful to stay inside. I mean, whether you're on your own and you're feeling lonely, or maybe there's a lot of you stuck in the same house, it can be really frustrating and stressful. So how do you take care of yourself during that time? What are some of the things you can do? The other really important piece to all of this is around stigma. It can be scary. I know that. I feel the same way when I go to a grocery store now, or when I have a pharmacy, go to the pharmacy, a little piece of me is really worried. Like, what if someone else is sick and isn't taking the same precautions that I am? They maybe didn't wash their hands, or they sneeze into their hands instead of their elbow pit. We can't let fear get in the way of what is true and what we need to work on together. We need to have solidarity. So people sneeze for a lot of reasons. I have allergies. Sometimes I sneeze because of dust. And that doesn't mean I'm sick. And so we have to be very understanding to people. We have to come together as a community, give each other advice, lean on each other, support people who can't go online to get information. Maybe your grandma or your great aunt or a friend doesn't have access to the internet. And so they don't have the same access to information. Well, help share that information with them. Let's look out for people in our community who are vulnerable. Let's make sure we're getting good facts and not fear are driving the decisions that we make. Because together, and only together, can we go and get through COVID-19. So our show here is to help share some of that good information. We are the Red Cross. Our show is We Are in This Together. And please stay tuned. Please send us your questions. We'd love to hear from you. I'm Angela, and I will talk to you again next week. Thanks a lot.